Hello and welcome to the TMJ review. We'll include the major muscles of mastication as well as accessory muscles of mastication. We'll also talk about their proximal and distal attachments, their innervation, as well as their jaw actions in concentric contraction. We'll also go over how to locate some of these structures on the person, as well as some of their bony landmarks I've seen on the skull. So first, let's talk about the major muscles of mastication, also called primary muscles of mastication. They are located here in green, pink, purple, and red. For those that are colorblind, I apologize, but have numbered them so it can aid you in your studying. Temporalis is a major muscle of mastication as we zone in on that. The temporalis muscle has two proximal attachments, one superficial part on the temporal fascia that covers its superficial surface. That comes from the superior temporal line, although the muscle itself is not attached to that line. The deep part attaches to the inferior temporal line. This muscle then inserts on the coronoid process and the anteromedial aspect of the ramus of the mandible. If you're ever asked, they'll ask you the coronoid process, not to be confused with the condylar process, which is the articular part of the TMJ. The innervations from the anterior division of V3, otherwise known as the mandibular nerve, and the particular branch is called the deep temporal nerves. Remember that the motor is in the front of most cars, and so motor is in the front of most nerve divisions. The actions are elevation and retrusion as major actions for temporalis. Moving to masseter. Masseter is a major muscle of mastication, a primary muscle. It's the strongest of all four. This muscle's proximal attachments come from the zygoma, which is the central part of the zygomatic bone, as well as the zygomatic arch, which is formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. The distal attachment, or the insertion, is the lateral or external aspect of the ramus of the mandible. Its innervation is again the anterior division of V3, otherwise known as the masseteric branch, and it does elevation, a little bit of protrusion and retrusion, and then ipsilateral deviation. By far, its best action is elevation. Now to the lateral pterygoid. The lateral pterygoid muscle has two parts. It has a superior head and an inferior head. Its superior head comes from the infratemporal crest of the sphenoid bone, and the inferior head comes from the lateral portion of the lateral pterygoid plate of the sphenoid bone. Its superior head then inserts more distally onto the TMJ articular disc, and the inferior head goes to the pterygoid fovea on the neck of the mandible. Its innervation is still anterior division of V3, the lateral pterygoid branch, and this is the only major muscle of mastication that does depression, which is why there's a star here. It's often asked that this muscle will depress. It protrudes if it contracts bilaterally, and if it contracts ipsilaterally, it will do contralateral deviation, drawing the jaw towards the sphenoid and moving it to the opposite side of the location of the lateral pterygoid. The medial pterygoid is very similar to the lateral pterygoid. It's very internal like the lateral pterygoid. It has a superficial head and a deep head. The superficial head comes from the maxillary tuberosity and the pyramidal process of the palatine bone. If they ask you, they'll typically ask you the maxillary tuberosity behind the third molar of the maxilla. The deep head comes from the medial part of the lateral pterygoid plate. Note that it does not come from the medial pterygoid plate. They'll often use that as a distractor. Make sure you understand it's the medial part of the lateral pterygoid plate. Both pterygoids come from the lateral pterygoid plate. It inserts onto the medial aspect of the angle of the mandible. This is reverse of the masseter. Masseter's on the lateral aspect, medial pterygoid's on the medial aspect. But the medial pterygoid's more towards the angle, and masseter's the expansiveness of the ramus. Now this structure has a different innervation. It's still mandibular nerve V3, but it's the main trunk, not the anterior division, but the main trunk. Remember that medial pterygoid comes from main trunk. This is the medial pterygoid nerve. It does elevation like most of the muscles of mastication. Bilaterally, it can protrude, and if it contracts ipsilaterally, it would do contralateral deviation along with the lateral pterygoid. Some accessory muscles of mastication that they may ask you about. The accessory muscles tend to synergize the action of the primaries. Genial hyoid comes from the inferior mental spine, also called a genial tubercle. It goes to the body of the hyoid bone. It's innervated not by V3, but by C1, the nerve to genial hyoid. And it forcibly depresses the jaw. like most accessory muscles of mastication. Mylohyoid. Mylohyoid is the diaphragm of the floor of the mouth. This structure comes from the mylohyoid line of the mandible. It inserts onto the body and a little bit of the greater cornea of the hyoid bone. It's innervated not by the anterior division, but by the posterior division of V3, nerve to mylohyoid, and it forcibly depresses the jaw. Digastric is very similar. The digastric has an anterior and posterior belly. The anterior belly comes from the digastric fossa of the mandible, and the posterior belly comes from the digastric notch of the occipital bone. It inserts onto the intermediate digastric tendon, and the anterior and posterior bellies have different innervations. The anterior belly receives that same nerve to mylohyoid from the posterior division of V3, and the posterior belly comes from cranial nerve 7's posterior auricular branch. They both forcibly depress the mandible along with mylohyoid and genial hyoid. Bucks-nadir is a special accessory muscle of mastication, which actually doesn't involve the chewing process as much as it aids the chewing process. This muscle comes from the pterygomandibular raphe at the alveolar processes of the maxilla and mandible. It inserts near the skin of the upper and lower lip, intermingling with the orbicularis oris fibers, another muscle of facial expression. Since Bucks-nadir is a muscle of facial expression, it is the buccal branch of cranial nerve 7 that innervates it. And it actually pushes food into the vestibule by helping the food contact the occlusal surfaces of the teeth. Now, let's just take a look at the major muscles of mastication on some surface anatomy. Note the temporalis is on the temporal fossa. It's going to insert onto the coronary process underneath the zygomatic arch, which we see blocked here. The masseter is located on that lateral ramus of the mandible. So these are the two external jaw muscles of the primary muscles of mastication. As we come to the other side, we can actually see, if we remove the ramus, we can actually see the lateral and medial pterygoids here. So lateral and medial pterygoid. You can see medial pterygoid has nerves on its surface from the posterior division of E3, whereas the lateral pterygoid is more superior, heading over to the mandible's TMJ disc and pterygoid fovea. Looking at some of the bony landmarks on the mandible, make sure that you know how to find the mylohyoid line. The mylohyoid line is that ridge that you see there. The digastric fossa, here and here, that's coming from the anterior belly to digastric. If you look at the angle of the mandible, see it's bumpy here on the medial surface. This is for the medial pterygoid. The TMJ disc would be located here above the condylar process of the mandible. And that pit that you see on the inside of the neck of the mandible is the pterygoid fovea for the inferior head of the lateral pterygoid. And again, this pointy-like process that you see here is the coronoid process, pointy like a crown. Just think of a corona beer, has a crown on it. This is for temporalis. And temporalis also inserts here. And of course, on this surface of the lateral part of the ramus of the mandible, this is going to be for your masseter. Don't forget, you also have these tiny little spines here for things like genioglossus and genial hyoid. On the skull, looking for some major landmarks for attachment. Here is the temporal fossa. We have this zygomatic arch for masseter. Looking inside the zygomatic arch, you can see the infratemporal crest here. That's for the superior head of the lateral pterygoid. And then here you have the lateral pterygoid plate. The lateral surface will be for lateral pterygoid, the medial surface for medial pterygoid. As we turn this upside down, you can see the maxillary tuberosity and pyramidal process right here, that pointy thing. This pyramidal process and maxillary tuberosity are for the superficial head of the medial pterygoid muscle. So hopefully you found these landmarks relatively helpful. Hopefully it helps in your aid of studying the muscles of mastication. And I will put a still of this chart underneath descriptions so that you can study it on your own and rewrite it. Make sure to write it in colors and different your own handwriting so that you can remember it much better. The colors will help the occipital temporal gyri get it really into the limbic system. And so when you close your eyes and you're in an exam, you can actually remember the colors and you remember your own handwriting. Hopefully you found this useful, and we'll see you next time.